In commemoration of the International Nurses and Midwives Week, the Upper River Region chapter joins the rest of the world to celebrate the day, beginning with a march past from the Regional Health Directorate to the Youth Center, where members converge to discuss important issues and well-being of the association. This year's celebration is banked on the theme, Our Nurses, Our Future, the economic power of care, with the slogan, Your Health is Our Priority. According to the chairperson of the Regional Nurses and Midwives Association chapter in the Upper River Region, Abdullah A. Barrow, commemorating the day in the region for the first time is a great opportunity, despite the challenges nurses and midwives encounter daily in serving humanity, while renewing their commitment and dedication to delivering quality and timely service to the people.
So as an association, we are definitely and completely for nurses. We are advocates for nurses. We stand for them, we try to express their challenges to people who are there, who will be able to solve their problem. The nurses in this country, especially those working in this region, are facing a lot of challenges. But with all those challenges that we are facing, we are still working hard to make sure that we serve the community. Those challenges will definitely be solved. But henceforth, the nurses will never relent to make sure that the community are well served.
The Information Public Relations Officer, the National Association of Gambian Nurses and Midwives, Umar Banle, gave a brief history of how nursing was founded, saying today it is one of the most magnanimous service rendered to people across the globe. Banle advised young nurses to be committed, disciplined, and passionate about their job.
We want to champion health and then also try to move to the next level. So that is why we try to see how best we can harness, the best out of the best from the schools to ensure that they become nurses, because health is a priority and it should be made a priority. If you go to work, it means you're healthy, both mentally, physically, and everything, at their right balances. I understand that, though it's very difficult to achieve all of this, but then primary health care is key.
The guest speaker of the event, Sambaba, who doubles as the principal nursing officer in the Upper River Region, said the commemoration is a recognition of the sacrifice and hard work nurses and midwives conduct daily in all parts of the world.
In the process of executing our duties, sometimes we are being bullied, our staff are being belittled, our staff are not being recognized of the good things that have been happening. But if you can look at all the third world countries, including the Gambia, the health sectors have been actually handled for the past decades by the nurses and midwives. To the young nurses, they have to be patient. They have to take perseverance and so that they do their job as expected of them.
The Public Relations Officer of the Nurses and Midwives Association in URL chapter, Usainu Dabo, highlighted the day's importance in recognizing the work of nurses and care providers. Dabo said the Association Upper River Region chapter took all necessary measures in revamping the association to cater for all nurses and midwives.
One of the activities that we embarked on was a regional tour to go through and exactly know what is in the minds of the nurses. So when we talk to them, we've realized some of them have no clue about the URR Nagam Association, and which we've tried to explain to them to better equip them as to know. But if you look at the crowd now, you would realize we have done an effort to bring all these people here for this Nurses Day celebration. As of now, we are only focused on the government staff for now. That, let's say nurses and midwives that are trained and they are under the government, because we have to undergo a registration, and then there has to be a payroll number for the registration fees to be paid. But then the other ones that are also in private clinics and they are nurses with certificates or no certificates, we are also working on them to make sure we also have ways for them to also register and then pay their dues as promised. Yes.
Members of the association appealed to the Minister of Health to employ more nurses as the human to patients ratio widens in a capacity gap affecting service delivery. Saidou Camara reporting for GRTS News from Upper River Region.